The first thing to do is to verify the doctor's order and the identity of the client to provide information about its physical limitations to ensure its safety. The next thing to do is to explain to the client the purpose of what are you going to do. This helps to reduce the anxiety of the patient and for increased cooperation. Place the one hand behind the client's back and slowly lift the patient into sitting position and then place the other hand into the legs without removing the hand at the back to prevent fall. Get the transfer belt and put it into the waist of the patient. After securing, instruct the patient to hold into your neck. After counting 3, lift the patient slowly and carefully, and then carefully assist the patient towards the chair. Transferring a patient from bed to chair or vice versa is important for both physical and emotional helps. It helps keep the patient active, maintains its muscle strength, and support independence. In addition to physical benefits, it can boost the patient's mood, make them feel more involved in their care, and encourage social interaction. Overall, it plays a big role in healing and recovery process. Verify the doctor's order and the patient's identity to ensure that the patient receives the right intervention and to prevent errors. After verifying, explain the procedure to the patient to reduce anxiety and for smooth cooperation.
Oral care, toothbrush po, and then back massage po. Ready na po ba kayo? Okay lang po. Sige, kunin ko lang po yung mga equipment.
Gather all the equipments to be used and perform hand hygiene, and then put on gloves. Lay a towel on the patient's chest to maintain its privacy. And also put towels beneath the places where you wash to prevent spilling water in the bed. Starting at the top, wash the face first and then the neck. and then proceeds at the patient's chest. Proceeds with the hands and arms of the patient. The next is the legs of the patient. While doing this, we should still maintain its privacy. Assess the patient at its side and proceeds at bathing its back. Bed bath is important because it keeps the patients clean and prevents infection. It also improves comfort and boosts circulation. And the next is shampooing the patient. Gather and place the equipments to save time. Put a towel on the eyes of the patient to prevent stinging from the shampoo or on the water. Assess the patient's head and proceed with shampooing. And then wash off the shampoo and dry it using a towel. Some patients need help with shampooing due to physical limitations. Nurse job is to assist the patient to keep them clean and feel comfortable. Remove all the used equipment and proceed with the third procedure, which is giving oral care to the patient. The patient is conscious and can lift up its body, but still needs help. For patients who cannot care for their own mouths due to physical limitations, nurse will give a oral care to the patient to prevent the buildup of bacteria that can lead to serious health problems. Giving oral care improves the overall comfort of the patient. And then the last procedure is giving back massage to the patient. Assist the patient to its side to its prone position. Giving back massages to patients help reduce their muscle tension and pain and also improves their blood flow and promote relaxation. This helps patients feel more comfortable and can speed up their healing. Massage also reduces stress and anxiety, which support the overall well-being during recovery. After finishing the procedure, help the patient back to its supine position and then remove all of the used equipment and put back its pillow for its comfort. Overall, these basic care activities may seem small but are very important in keeping the patient clean, healthy, and comfortable, and in supporting their physical and emotional well being.